Hey MP students, we're going to talk about the diagnostic criteria for diabetes. So what are the numbers that you're looking at or looking for when you're in clinic and you're trying to diagnose someone with diabetes? This is going to be great if you're about to start an adult health rotation or maybe like an internal or geriatric rotation, because you're going to need to know these numbers. So we have 3 or 4 different type of tests that we're going to be looking at. It's going to be our hemoglobin A1C, a random blood glucose, a 2-hour glucose test, and then we're going to do a fasting glucose. So normal parameters that we're looking for A1C is going to be anything less than 5.6. Anything under 5.6, we're in the clear, and that means that this patient, according to our A1C, does not have diabetes. Or we're looking for a fasting blood glucose under 100. And with our 2-hour glucose test, we want it to be under 139. And then there's really no parameters for the random glucose, but we want it to be, because I could have just ate a fat piece of cake and my blood sugar could spike, but it will normalize back out afterwards. So now for pre-diabetes, because they are a separate population. So for pre-diabetes, the A1C is going to be anywhere between 5.7 and 6.4. That is going to be the pre-diabetic range. And then the fasting blood glucose is going to be anywhere between 100 and 125. Our 2-hour glucose tolerance test is going to be anywhere between 140 and 199. And then once again, there's going to be no diagnostic criteria for a random blood glucose for a pre-diabetic. Lastly, the diabetic patients. This is where we're going to say, buddy, what you've been doing, what you've been eating, because I need to figure it out. So anyone that has an A1C that's going to be greater than 6.5, you got the diabetes. Typically, that's what that means. Or a fasting blood glucose is going to be above 126 fasting. So we haven't eaten anything, you haven't had any coffee, you haven't had any croissants, you haven't had any church candies. All those things are going to be very important when we're looking at that fasting blood glucose. And then our 2-hour glucose tolerance test is going to be anything over 200 for the glucose tolerance test. And then a random glucose is going to be anything that's over 200 plus that patient is symptomatic. So sorry, my phone cut off, so I'm sure that you guys saw in the video it was like a little chop. I had to go and delete some stuff. So please let me know if you guys found this helpful. Next, we're going to go over hyperlipidemia, and then I'm also going to go over hyper and hypothyroid and how you can pick out these numbers on tests and what the diagnostic criteria for those disease processes would be. So as always, I wish you guys the best of luck on all your endeavors, and I hope you guys have an amazing day.